Hi, this is Bruce Allen from Moorfields Eye Hospital with some tips and tricks on DMEK donor tissue preparation, aimed primarily at our trainee corneal surgeons here, but if it's useful for corneal surgeons making the transition to DMEK elsewhere, then that's great. I should say right off the bat that a lot of these ideas are borrowed from other surgeons. I would encourage you to look around at conferences, fora like YouTube, and visit other surgeons and incorporate all the best bits from their technique into your own. So we're starting off with some trypan blue just to stain up Schwab's line nicely and diluting that out with some BSS. Now the first little trick is to not waste too much time hydrating sponges. Just lift the donor button gently, empty the fluid into the stand and empty the fluid from the stand into some gauze swabs by the side. And then you can replace the donor button there and you're ready to go. And what's quite nice is leaving a little pool of dilute trypan blue in the bottom there. That's going to pick up into your score as you go through, and that helps you to see where your score is. And you want to be just under Descemet's membrane in the periphery here with a light touch all the way around. And what we're going to be showing you later on is this technique of using the closed forceps just to trap the graft there as you pull across with the Sinskey hook. Now here we've got into the stroma, and so you want a light touch to avoid that, but if you do get into the stroma, just go back and very lightly drag across it. And again, if you're not sure, go back into your track and stay within the score you've already made as far as that's ever possible, and then just come lightly across the point you're at there. And keeping a light touch throughout helps to avoid this. And we're just going to go past this section here, and there we are, progressing again nicely, and all the time staying in the periphery. And if it looks like we're drifting into the center there, then just make the correction by moving the forceps out posteriorly there, and that changes your angle of attack, and try and finish up in your original groove there. One continuous score, no tags, no weak points when you do the peel. And again, stain up with trypan blue there. Dilute up and empty out onto the stand, and then empty the stand onto the gauze swabs by your side. So we're just going to pause here to emphasize some key points in making the score, which is really the key stage in the donor preparation. First of all, rest your hands on the stand, and it's the cornea that rotates, not the stand. And we're just going to make that point with a rapid motion video here. Think of this being like a record player there with the Sinskey hook scoring across the graft. Second point is the trap, pull, release, push technique. We're going to see that here in slow motion. And so what you're doing is you're trapping with the forceps closed. That gives you your anchor point, and then just pulling with a very light touch using the Sinskey hook, then releasing with the forceps and pushing with the Sinskey hook to rotate the graft. There we are. Trap, pull, release the forceps, push with the Sinskey hook. Then maintaining a light touch all the way through, very important, and trying to avoid getting into the stroma and the pre-Descemet's layer. Doesn't matter whether you're preparing the donor or scoring the host, exactly the same thing. A light touch, stay out of the pre-Descemet's layer. And if it looks like we're getting caught up there, just ease off with the Sinskey hook, look for your score again, go back in the groove and come across it lightly for a second time, and take as much time as you like over that. And what you're trying to avoid there is making tags and tears in the edge here, which is going to make it difficult when you come to the peel stage. So we've just about got out of that one. We got trapped again there. Very light touch, just finding our score again, just underneath there, and then proceeding. Okay, so maintaining a light touch, very important. Staying peripheral is also important when you're making the score, to leave yourself plenty of room to trefine centrally. And a really nice point to make here is that the place that you put the forceps down to trap alters your steerage. You can see we're going into the center there, so we move the forceps posteriorly to alter the angle of attack to get into the periphery again. If we're too peripheral, then move the forceps closer again, altering the angle of attack, and then you can steer around nicely back into the point where you started the groove to give you a nice continuous groove. And that gives you no weak points when you come to the peel. There are large diameter guarded trefine systems that do this for you, but the Sinskey is very nice because it teases up desmase and it actually makes it much easier to initiate the peel when you come to this stage. So we're ready to do that now. We've got a nice continuous score. Fill up with BSS, everything underwater, the scuba technique, and then just gently grasp the desmase and peel across. And there we are, we've just pulled through there, so we're just going to move off to the locus just to the side there. And at this stage we're not worried about endothelial damage at all because we're right in the periphery to where we're making the graft. Little rocking motion's very helpful just to help the thing move across. And if you get stuck moving to the side to a point close to where the peel is being initiated, you can move around the graft Rexis style like that, peeling it in quadrants, and some surgeons prefer that. So having got most of the way across, about 80 or 90%, then a very nice way of atraumatically putting the desmase back in is to fill up with BSS and then simply to lift the graft out, and then the capillary action of the BSS draining away will flatten the desmase membrane really nicely. Then we're ready to empty out our fluid again there and place the donor button back. And at this stage you do want your sponges, and here we're going to use them to dry the donor button onto the stand a little bit. And again, it's capillary action. It helps the donor button to be nice and steady on the stand when you come to the trephination. So we're going to center up over those dots there with reference to the score we've made, and then place the trephine guide and then drop the trephine down nicely in the center, making sure that we've got well inside our score there. And then what's very nice is a little rocking motion to make sure that we get through desmase. Very important to get through desmase. It's better to go full thickness than to not get through desmase. But do a nice partial thickness stromal trephination if you can. You soon get a feel for that. A nice rocking motion with the trephine helps you to make sure you're through all the way around. And then we're ready to peel out this redundant strip in the periphery here, and you can rex that around, sort of capsule rexus style, tangential to the donor to give you a nice clean edge to it, and making sure you've got a lovely clean donor disc in the middle. Now here we want to minimize our fixation and just choose one point, teasing it up gently there. There should be almost no work in the peel here. It's all been done for you earlier on. Just taking that across and then dropping the donor back in the pool of BSS there to scroll up, and that's lovely. And all we need to do then is fill up with BSS and put the cap on, ready for the graft to be used. Now you may be wondering at this stage about orientation marking. There are some very nice systems described for this. Mark Terry's got a nice little S-shaped marker for the stromal side of desmase. And Manny Bogle has described a nice asymmetric triangular bite, very easy to do before you initiate the peel of the central donor. And he's written that up in JCRS in 2015. Truthfully though, we're not marking anymore, or very rarely. The orientation is pretty obvious in the anterior chamber in almost all cases, using dual blue staining, that's trypan blue and vision blue combined. So look, I hope those tips are useful, and I wish you luck with your surgery.